At our offices, the dental implant treatment process happens from start to finish. We will always start by making sure that you're healthy enough for implant treatment. So we'll send a medical history release to your doctor to make sure that you're healthy enough for implant treatment. Then we'll begin by having a 3D CT scan done in the office, and also we'll typically take a 3D scan with our intraoral scanner of your mouth, and we kind of merge that data together to optimize where we're going to plan your implant treatment. A typical single implant takes less than an hour. You will come back after the implant treatment in about 10 days to remove any stitches. Then you will come back in 2 to 3 months' time to check that the implant has healed. Then we will take an intraoral scan again to customize your unique crown that's made, and also the shading and color match to your adjacent teeth. Once the porcelain crown comes back, we insert the porcelain crown. We check the fit, we check the bite to making sure that you're happy with the result, and we go over instructions on how to use your brand new teeth, including home care, how to floss around your implants, what to use, things like water picks to keep the area clean. And we recommend coming into the practice every 3 to 4 months to make sure that your implant stays healthy.